Dear pediatricians, our interest lies in children. Why are we talking about adult vaccination? What is the rationale behind this? So, as we very well know, there are instances where we see children right from birth, and many times they keep coming back to us beyond childhood. Sir was just mentioning regarding a case of aneurysm, 22-year-old, 24-year-old whom he diagnosed. So that being the case, we become trusted family counselors. Of course, vaccines is what we advocate always. As pediatricians, we are very strong advocates of vaccination. And when a pediatrician talks about vaccine, whether regarding children or regarding adults, it tends to be taken more seriously. So we can be drivers of acceptance and having a family vaccine approach. Being in India, where 3-generation families still exist, many a times elderly people living along with children can become harbors of infection. So they can be spreading it to the younger children at home. So immunizing adults and elderly at home can create a wall around children and help protect children. So pediatricians as trusted family advisors play a pivotal role in driving vaccine acceptance across all age groups. So a life course of immunization means lifelong protection, and there is intergenerational care. So there is care across generations, and of course herd immunity has given us success stories of smallpox and polio elimination. But not just that, even regarding diseases like influenza and COVID-19, herd effect can give rise to some kind of a community equilibrium, reducing the spread of these diseases. So family vaccine approach ensures lifelong protection, strengthens generational care, and builds community-wide immunity. So what is the burden and what are the challenges of adult vaccination in India? So we are talking of influenza, where between 2015 and 2019, 1,26,906 cases and 7,865 deaths were reported. Pneumococcal disease, hepatitis. We do see an epidemiological shift now with good immunization in children. These diseases have shifted to older adolescents and adults. And we know that the single most important factor in the symptomatology of hepatitis A is age. So younger children mostly asymptomatic. Nearly 90% of older children and adults will have symptoms including fulminant hepatic failure. India is the hub of cervical cancer, with over 1 lakh new cervical cancer cases diagnosed every year and 1/3 of the world's deaths, 60,000 deaths per annum. 60% of the world's diphtheria cases are in India. Typhoid, measles, rubella also carries the burden of congenital rubella syndrome when a pregnant mother gets it. So all these are diseases which need to be addressed, which cause significant morbidity and disability in the elderly. So there is an increasing burden of vaccine preventable diseases in India, and we are also talking of a population which has comorbidities. Diabetes, hypertension, hypercholesterolemia, obesity, basically syndrome X, cancers, along with the treatment, immunosuppression. So all of this adds to the increasing risk, and there is one war going on outside. But this war of man against microbe has been going on and will continue to go on. So in order to cut the antimicrobial resistance that we are facing, somewhere immunization plays a role. And of course, immunization is the most cost-effective method of increasing health of any community. So when overall number of cases come down, definitely the usage of antibiotics as well as the emergence of resistance will also come down. So pneumococcus, influenza, shingles, these are vaccines recommended for individuals over 50 years of age because also of immunosenescence. So here is a graph which shows how immunity versus the disease burden changes with age. So in childhood, we have a well-developed structured immunization program, high vaccine coverage, high awareness. Yellargu gottu, even the poorest person, tika lagaya hai, haan lagaya hai. Everybody knows. So it is very well implemented. So although the newborn has an immature immune system with a risk of infection, with robust immunization, there is improved immunity, immune system developed through childhood and adulthood, it's maintained. But with age, there is immunosenescence. In adulthood, there are no national guidelines, negligible vaccine coverage, and low awareness. So all of this contributes to again increase in the risk of infectious disease with age. So in your clinical practice, how often do you come across adults with influenza, pneumococcal infections or other vaccine preventable diseases? And what challenges do you face when recommending adult vaccines, for example, HPV, influenza or pneumococcal to your patients? Any personal experiences?
You mean the diagnosis of these diseases in adults or vaccination?
Vaccination.
It is the inertia, emotional inertia. ನಮಗೆ ಯಾಕೆ? Probably.
Yeah, and I've had patients saying, flu vaccine alla lobbying ashte. Nam benefit ಮಾಡ್ತಾ ಇದೀವಿ ಅನ್ನೋ ಥರ, that is one thing.
That is there. Initially, as a psychological aspect, first thing is nammeಲ್ಲ ಏನ್ರಿ ನಮ್ಗೆ ಆಯ್ತಲ್ವಾ?
Yeah.
It's sort of
At least the set of patients know who approach me a lot. Most of them they ask me, sir, ನೀವು ಕೊಡ್ತೀರಾ influenza vaccine, pneumococcal ಎಲ್ಲ? We want to take you. I'm also traveling because they're aware of it. There ತುಂಬಾ awareness ಬಂದಿದೆ. And especially if somebody is a frequent traveler, every year they come to me and they take influenza vaccine. Likewise, even the pneumococcal vaccination definitely has picked up in adults. Especially, thanks to our fellow pulmonologists, our hail kadastara, you're 50 plus, please go to your pediatrician and take it or come here. So, definitely the awareness is there and they are coming to the pediatricians and they're very comfortable taking vaccines from us. Trust me.
Yes, because somehow pediatrics has become equal to vaccines. Adult vaccination centers, that's probably one of the needs. So what are the...
Only issue is, if you are vaccinating adults in your clinic, you have to be competent to handle adverse effects in adults. Unless you're confident in that, I think you should not. Do you know how to manage anaphylaxis in a 60-year-old fellow whom you are vaccinating? Be very careful about that.
Thank you, sir, for that word of caution. So now, what are the barriers to adult immunization coverage in India? So it's very nice to hear from sir that actually awareness is good, but according to some studies, 80% of adults are actually uninformed about adult vaccination. You know what sir told, namgela yake idu. So there is a myth that vaccination is only for children. So there is that concept that we are actually talking of 3 C's. First is complacency. Nanag kaile baralla, nangen beda idu. Second is convenience. We are talking of a working population. It should be available at their convenient time, at their convenient place. Only then they will go and take it. And third is confidence in the system. Really, is this required? Probably if Dr. Nagesh says, everybody will agree, how the beku Nagesh sir helidare. But otherwise, that acceptance and that confidence in the healthcare system, whether it's really required, and that community acceptance of vaccines. So to address all these C's, I think our communication, the way we communicate with our patients and put across the importance of these vaccines will go a long way in improving adult vaccination acceptance. So this was a knowledge attitude practice survey performed under 500 voluntarily consenting pediatricians. It was done as a questionnaire. And the result of this showed that 39.6% pediatricians recommend vaccinations for adults over 60 years who were accompanying the children. 33.2% of them tell it only when some other physician would have recommended it. 72.1% of them give preference if they have a chronic lung disease or a heart disease, and only 5 to 20% of families were even aware that there is something called adult vaccination and it has to be given, and it's not just the children, we should also take, apart from COVID-19 of course. And only 30.4% of pediatricians themselves who belong to the qualified age group had actually taken the pneumococcal vaccine. So this was the study. So one thing is, we do not have dedicated adult vaccination centers, and these should be available over extended period of time. As I mentioned, they are working people, so at their time of convenience it should be accessible, available, and so the need for this kind of adult vaccination center is that remains unmet. So the bridging the gap and overcoming adult vaccination challenges in India includes educating healthcare providers and public, establishing adult vaccination clinics where there are standards of immunization practices, including how to handle emergencies in adults, identifying and addressing missed opportunities, and I think this point already came out, integrating across specialties. In probably the pulmonologists are the greatest advocates of adult vaccination now. So across specialties, when the same message is conveyed, oh, hammer, hammer, hammer again and again, then probably the public awareness will improve. Yet another study aimed at seeing the disparities in adult vaccination so far as affluence is concerned, and definitely the more affluent group, more likely that they will take the vaccine, and there is an affluent advantage. The most affluent had higher vaccine coverage across all types of vaccines, and the peak uptake was diphtheria and tetanus vaccine in the affluent group. Unfortunately, even that remains an abysmally low of 4.21%. And the least acceptance was in the poorest deprived group, that is the least financially affluent group of the pneumococcal vaccine. So considerable affluence or financial variations exist in vaccine uptake in adults, and even in the affluent groups the acceptance is still quite low. Probably one of the reasons being that these vaccines are not given for free. All of them are paid vaccines. So there is increased morbidity and mortality. See, our vaccination, primary vaccination coverage is very robust. It's better than 90%. But with age, there is immunosenescence, and that booster effect of vaccines needs to be given, which remains an unaddressed need. So there is perpetuation of health inequality. The poorest become most vulnerable to vaccine preventable diseases, and that increases their chance of contracting the disease when there is no immunization, as well as morbidity and mortality. So the health discrepancy worsens, and there is indirect effects in terms of loss of work days, sickness absenteeism, or reduced work performance, and there is increased antimicrobial use and development of antimicrobial resistance. So all of this can be addressed if we can improve our adult vaccination rates. Of course, there is also a demographic and epidemiological transition in India. So those aged over 60 years has increased from 6.1% in 1990 to 10.1% in 2020, and by 2046 the greater than 60-year-old age group will surpass the 0 to 60 14-year-old age group. So by 2046 I will also go to the senior citizen category. So by then our population would have exceeded the youngster population. We would have become a top heavy nation. So
our children have more children.
So there is increased incidence of diabetes, hypertension, cancers, all of which predispose to increased vulnerability to infectious diseases. So the aging population needs vaccination against influenza, pneumococcal disease, shingles and pertussis. In fact, 31st October has been declared by WHO as the World Cities Day, because a lot of problems arise out of urbanization itself, whether it is related to pollution or lack of space to exercise, road traffic accidents, high stress level, depression, while non-communicable diseases tend to increase with all this, our vaccine preventable diseases are also prevalent, and those risks also persist. So the importance of vaccination in adults is to prevent development of antimicrobial resistance, preventing complications of diseases and death, restricting the spread of diseases, cost savings, and most importantly, promoting healthy aging. That's another term adopted by WHO, where we need to encourage healthy aging. Now a small note on pneumococcal vaccination in adults. So 30 to 55% of community acquired pneumonia in adults is due to Streptococcus pneumoniae. Almost 80% of community acquired bacterial pneumonia is strep pneumoniae, and strep pneumonia is the most frequent complicating pneumonia after a viral pneumonia. So all of this justifies the need for pneumococcal vaccine. India contributes 23% of global pneumonia burden with a fatality of 14 to 30%, accounts for 10 to 30% of hospitalization, rising to about 60 to 70% in the elderly. And it also accounts for 39% of IPD cases with a higher case fatality rate. So risk of pneumococcal disease also increases with all of these comorbid conditions, whether it is related to the heart, lung or the kidney. So all of this increase the risk of pneumococcal disease. Now finally a note on us. Children are children, ಮಕ್ಕಳನ್ನೆಲ್ಲರೂ ನೋಡ್ಕೋತಾರೆ, ಮಕ್ಕಳ ವಿಚಾರವಾಗಿ ಯಾರೂ ರಿಸ್ಕ್ ತಗೊಳ್ಳಲ್ಲ. That's the common statement made. And now we are talking of elderly high risk group pregnancy vaccination. But somewhere along the line, healthcare workers get neglected. We are frontline exposure, it's an occupational hazard. We work in high risk areas, and also we ourselves can be harboring the infection, transmitting from one patient to next. So somewhere along the line, there is a lot of vaccination gap within the healthcare workers themselves, wherein there are no guidelines or no set rules that all healthcare workers should take these vaccines. There is no set rule like that. So, and also comorbidity, you will agree with me, or is also higher among doctors as compared to general public. So this is the list of WHO recommended vaccines for healthcare workers: BCG, diphtheria, hepatitis B, influenza, measles, meningococcal for healthcare workers at continued risk, pertussis, polio, rubella, SARS-CoV-2 and varicella when there is no previous history of the disease. So what are the barriers to?
Pneumococcal is not there in that.
Pneumococcal is there in API.
So not for this one, healthcare workers.
It is there in our API guidelines.
This is also for healthcare workers.
Healthcare workers only.
But the WHO doesn't.
WHO guidelines is not there. So the barriers to vaccination of healthcare workers include lack of awareness, doubt about efficacy, tight schedules, concerns about side effects. Ondina kaino band practice madakagdidre ಏನು ಮಾಡೋದು? Then absence of official recommendations. Probably if there is a recommendation from our governing body, then we'll all be more ready to take the vaccine, and it should be accessible. I know, I have taken flu vaccine and every time.
Not that. I took that pneumococcal 20. In fact, I had to call up Dr. Kashi and just find out. Is it something? 3 to 4 days I suffered pain.
Pneumococcal 20.
Yeah. Not 20.
Use will get Zora.
This in the ತಗೊಳ್ಳಿಲ್ಲ.
You have
That is why
taken.
CDC has not recommended PCV 20 for those who have completed PCV 13 schedule. Reactivity is more.
Reactivity is more.
Okay. So immunization records for elderly also, like how we have vaccination chart for children in the form of a card, ideally should be maintained so that we can do the catch-up vaccinations. So API guidelines recommend influenza 1 dose annually, pneumococcal PCV 13, 1 year later PPSV 23, hepatitis B 3 doses, hepatitis A 2 doses, MMR, typhoid, MMR 2 doses 4 weeks apart, typhoid, HPV 3 doses and DPT, Tdap once in 10 years. So all of these are the recommended vaccines for adults according to API. So finally, the key takeaways of this presentation are: pediatricians can drive.
Previous one, they say HPV for adults above 46 years. Is that
No,
so?
that's why I skipped this side. This was shared by them.
Previous one, the HPV previous.
It is below 46 years, it should be actually.
It's more than 46 years.
No, it should be less than. Less
should be
than,
less
up to
than
45, less than.
45.
That's what I was wondering.
Less than. Okay, so pediatricians can drive adult vaccination awareness
You are awake.
ಚೆನ್ನಾಗಿ ಮಾಡಿಲ್ಲ ಸರ್.
through trusted family counseling. Life course immunization means lifelong protection against vaccine preventable diseases. Adult VPDs cause significant morbidity and mortality in India. Awareness, access and policy gaps remain the major barriers to adult vaccinations. Missed vaccinations increase healthcare costs, inequities and antimicrobial resistance burden, and dedicated policies and adult vaccination clinics are critical for India's future. In the ideal scenario, adult vaccinations should become involved in our universal immunization program. In that case, I think we will be completely successful. Thank you very much for your patient hearing.